Hello everyone and welcome to a presentation focusing on the larynx about vocal abuse.
Margaret is a 55-year-old woman with vocal abuse. She is employed as a high school gym teacher who says she needs to give instructions to at least 20 adolescent girls, either in the school gym or outside on a daily basis. Talking in a loud voice for sustained periods is required in her line of work, but it is quite probably a source of phonotrauma or voice abuse. Margaret has smoked since the age of 18, but reports that she cut back to one cigarette a week 5 years ago when she noticed changes in her voice, which is very noticeably hoarse. She also takes antihistamines seasonally to treat her grass seed and ragweed allergies. Both smoking and taking antihistamines further aggravates Margaret's condition. Margaret has a unilateral pedunculated hemorrhagic polyp on her right vocal fold. This causes her to suffer symptoms such as diplophonia, the audible perception of two distinct pitches during phonation, probably caused by the increase in mass that the polyp creates on one of Margaret's vocal folds. She also has sudden voice breaks. These occur when the stalk of Margaret's polyp bends and falls between the vocal folds, causing a disruption in the vibration of Margaret's vocal folds, causing her voice to break.
What is vocal abuse? Vocal abuse is also known as phonotrauma. It is defined as any behavior that causes hyperadduction of the laryngeal muscles and excessive vocal fold vibration that causes friction. Consequently, it results in changes in laryngeal tissue. One of the most noticeable characteristics of phonotrauma is a hoarse, breathy, or low-pitched voice. Unfortunately, it doesn't take much to traumatize the vocal folds, and the most common causes of vocal abuse are yelling or screaming, excessive talking, dehydration, as well as frequent coughing, grunting, or throat clearing. Vocal abuse is often categorized into 4 different types. First type is growth on vocal folds, which are most common and further divided into nodules and polyps. They will be discussed in detail in the next slide. The less common types are contact ulcers, vocal fold tumors, and vocal fold paresis and paralysis. Both nodules and polyps are non-cancerous. The easiest way to distinguish them is that nodules are callus-like, whereas polyps are blister-like mass. Nodules are commonly known as singer's nodes or teacher's nodes. They usually start as soft, swollen spots and develop harder, larger, and stiffer as vocal abuse continues. These spots are bilateral and symmetrical. Polyps appear small and soft swelling or bump, but also can be stalk-like or blister-like. Unlike nodules, they are fluid-filled or blood-engorged and usually only on one side. They're mostly caused by a single traumatic episode of vocal abuse. There are 2 types of polyps. One is sessile or broad-based, and the other is pedunculated or stem-based.
Epidemiology. In adults, females are reported higher than males to be diagnosed with vocal abuse. In children, males are reported being diagnosed with vocal abuse higher than females. The quote below is from ASHA's website and states the prevalence is higher in adult females than adult males, with a reported ratio of 1.5 to 1.0 by Martin and others in 2015 and Roy and others in 2005. In children, vocal disorders are significantly more prevalent in males than in females, and this is by Carding, Rulestone, Northstone, and the ALSPAC study team in 2006, also by Martin and others in 2015. Who is at more risk of vocal abuse? Any profession that causes a person to use their voice continuously without rest, such as teachers, telemarketers, singers, and many other professions. Preventative measures. How to take care of your vocal folds. By staying hydrated and drinking lots of water, it helps reduce the dryness of your throat that can cause vocal fold malfunction. When speaking, use your voice in a comfortable level and reduce raising your volume. Try using Appropriate gestures to attract a person's attention. When ill, reduce trying to clear your throat. Try to resist the coughing and drinking water instead, or using throat lozenges. Vocal training is recommended to singers to ensure the longevity of their voice. Smoking and excessive drinking of alcohol should be limited or eliminated from one's lifestyle to ensure overall health and healthy vocal folds.
Polyps. Polyps are defined as the abnormal overgrowth of tissues on mucous membranes. They often appear as round blisters, bumps, or even as stalk-like growths over time. Polyps generally form on one side of the vocal folds, making them unilateral. However, bilateral polyps have also been observed in humans. There are two different types of polyps, which include pedunculated and/or sessile. The defining feature about pedunculated polyps is that they have a stalk attached to the surface of the mucous membranes, whereas sessile does not. During normal speech production, the right and left vocal folds vibrate. This causes the middle edges of the vocal folds to collide into one another like a whip. If pedunculated polyps are present, the middle edges of the vocal fold are impeded, resulting in more irritation and damage along the vocal tract. This leads to excess air regress during phonation, decreased pitch range in the voice, and frequent voice breaks and dysphonia. The most common cause for polyps is vocal abuse and other factors which include chronic smoking, hypothyroidism, or even gastroreflux. In the case of Margaret's diagnosis, she has been smoking for about 18 years. Even though she has significantly cut back, the long-term effects of chronic smoking has been enough to elicit vocal polyps for her. Prolonged vocal abuse due to providing loud oral instructions as a gym teacher has consequently led to the rupturing of her blood vessels. This has ultimately led to her diagnosis of unilateral hemorrhagic polyps. Of Margaret's diagnosis, it has gravely impacted her communication abilities. Margaret is displaying symptoms of voice break and diplophonia due to the polyps that are present on the middle edge of the vocal folds. This means that Margaret's voice will sound a lot breathier. Because of the polyps, multiple notes will be produced at the same time due to air escaping laterally. Margaret's voice will also sound raspier. Margaret's seasonal allergies will cause swelling along the vocal tract. This will consequently lead to feelings of unease and scratchiness in her throat, resulting in a much more strained, low-pitched voice. Margaret will also struggle with producing higher-pitched sounds. Laryngeal muscles in the vocal folds are not able to withhold the same level of tension in the muscles due to the polyps. This will result in Margaret struggling to produce higher-pitched sounds like consonants. Additionally, if Margaret were to sing in a high falsetto pitch, she would also have grave difficulty, resulting in specific syllable dropouts.
Next, we will be discussing the general anatomy of the vocal folds and larynx, as well as how that pertains to Margaret's diagnosis. Phonation is made possible by the vibrations of the vocal folds in the larynx. An individual is able to change the pitch or frequency, as well as the tone of their voice, through the manipulations of the tension and length of the vocal folds as the air passes from the lungs and out of the oral cavity. These movements are performed by the intrinsic muscles of the larynx, which, when contracted, work through specific laryngeal cartilages to manipulate the vocal folds. Generally, when producing higher-pitched sounds, there is more tension in the vocal folds, and they are also vibrating at a faster rate. Inversely, when producing a lower-pitched sound, there is less tension in the vocal folds, and they vibrate at a slower rate. The retinoid cartilage plays a big role in the movement of the vocal cords as it attaches to muscles that manipulate the folds as well as the folds themselves. The thyroretinoid muscle works to relax and shorten the vocal folds, thus diffusing tension and resulting in a lower pitch produced. Its antagonist muscle, the cricothyroid, works to lengthen and increase tension, therefore resulting in a higher pitch produced. The posterior cricoarytenoid muscle focuses on the abduction of the folds, in other words, opening the folds and exposing the glottis. The lateral cricoarytenoid muscle focuses on the adduction or closing of the folds. The picture at the bottom simulates the movement of the vocal folds. Now, with all this background anatomy knowledge, in Margaret's case, the polyp is situated on the vocal fold in the mucous membrane. All vocal folds are covered in a mucous membrane to ensure for proper lubrication when phonating. In addition, her chronic allergies and smoking habits have left her with a hoarseness and swelling in her vocal folds. This will create difficulty in the proper vibration of them. In addition, her pedunculated polyp is prone to flopping in and out of the glottis, which impedes proper fold adduction, therefore causing intermittent voice breaks. In terms of the impairment of her current condition to the anatomy of the larynx and folds, Margaret experiences no difficulty with any of the muscles of the larynx or the movement of the cartilages. The problem lies in the mass that is obstructing the proper reduction of the vocal folds in order to phonate properly. Imagine trying to close a Ziploc bag with a piece of rice stuck in your way. Consequently to her smoking and allergy issues, the vocal cords have become chronically inflamed and swollen, resulting in her low-pitched voice. Margaret's muscles may become overworked and fatigued due to constant repetitive strain and forced closure of the folds while trying to speak normally.
Vocal polyps do not typically disappear on their own without addressing the causes and taking some course of treatment. If polyps are left untreated, the individual will continue their harmful vocal habits, leading them to likely experience more discomfort, worsened symptoms, and possible permanent damage to their voice. The most common treatment options for vocal fold polyps include vocal rest, voice therapy, singing therapy aka melodic voice therapy, and phonomicrosurgery. In regards to phonomicrosurgery, some associated risk factors include allergies, damage to peripheral tissue, and general anesthesia. These options can vary depending on the degree of voice limitation and vocal demands of the individual. Treatment options should be discussed with an otolaryngologist, aka ear, nose, and throat doctor. Voice therapy is a good and recommended alternative for individuals who cannot or do not want to undergo surgery. This therapy focuses on improving vocal control and voice quality, educating clients about vocal hygiene, such as the harmful effects of chronic coughing and throat clearing, as well as how to breathe and speak properly without causing vocal abuse. It can also involve a number of breathing, phonation, and relaxation exercises. Voice therapy can range from 1 to 4 months, depending on the individual. While microsurgery would be the quickest course of treatment, it is costly, the recovery period can be time-consuming, and there are associated risk factors. Therefore, Margaret will take 1 week off from work for vocal rest and at least 1 month, 2 sessions per week, of voice therapy with a speech-language pathologist. Although Margaret has lessened her smoking habit down to 1 cigarette a week, it is suggested that she stop smoking completely to avoid any more damage to her vocal folds and a reoccurrence of polyps.
This concludes our presentation on vocal abuse. Hopefully through Margaret's analysis of her case, you have learned a lot more about vocal abuse as well as how it can impact an individual's life. The next 2 slides are our sources and our bibliography for this project. Here we found useful resources to learn more about vocal abuse, as well as pictures to demonstrate what vocal abuse is. Thank you so much for listening to our presentation.